How they doing? How's everybody? We are back, we are back, we are back. We are discussing the issue of the healthcare system in the United States of America. And the issue that we are discussing today is the issue of why hospitals don't allow out-of-pocket payments from certain patients. This is often from insured patients. Patient gets diagnosed with a condition, they get told what it is that they need to be treated, and then they find out that oops, your insurance doesn't cover this treatment. And then it turns out that, well, this patient can actually pay for their own treatment out of pocket, even though the insurance does not cover that treatment. And then often what tends to happen is that hospitals refuse to treat those patients. Why would such a thing even be happening? And then there's scenario number one. Scenario number two is when American hospitals outrightly just refuse to treat patients who don't have insurance, even if these patients have the ability to pay for their treatment. How can such a thing even be legal in the United States of America? Folks, this issue of healthcare in the United States of America is actually similar to the issue of immigration or something like police brutality. It's something that politicians don't want to fix. They just want to run on it because it keeps them getting elected into office by pretending to care about something that they actually don't care about. Because if they really cared about this issue, there are many solutions to this healthcare problem who don't require socialized medicine, by the way. There are many fixes to the problem of American healthcare that don't require you to tax people to death. But the politicians are not interested in coming with any solutions. The only thing that they're interested in is to run on this issue, election after election, run on it, because it will keep them feeling like they care about the issues that affect the people. They can get elected after election while they are not doing anything about it. One of the things that I realized in doing my research is that after the private hospitals were required by law to declare the prices for treatment, it turned out that the prices charge insured patients are much higher than the prices that are charged to cash patients. Let me repeat that. If you are receiving treatment in a hospital in the United States, you are paying from your pocket, the prices that you pay when you're paying from your pocket compared to the prices that you pay if you're insured are different. The agreements that private hospitals have with these insurance companies are such that prices that get charged to insured patients are much higher than the prices that get charged to cash patients. That on its own is evidence for me that there's a big problem here. There's a big problem. Because why would you be charging cash patients different prices than what you are charging insured patients? It also goes to the issue of saying what happens when a patient who has insurance. What happens when a patient who has insurance? And here I'm not talking about copays. No, I'm not talking about that. I'm talking about a patient who has insurance and wants to get a particular treatment, and then they are told by the hospital that this treatment is not covered by your insurance, but this patient has the money to pay for it, and the hospital says, no, you cannot pay for it from out of pocket. Apparently, this is happening because there are certain agreements between these private hospitals and insurance companies which prevent hospitals from giving care to patients even when patients can pay for the care. Which gets me to a point that what is actually happening in the American healthcare system is that this is a system that is designed to how do it is designed to serve the hospitals and to serve the insurance companies. It is not designed to serve the patients. I see that someone is looking for an example about this matter. There are many examples that I can think of. For instance, there is an actor right now who, let me just go back to Venus Williams, who went back to playing tennis, even though she's a multimillionaire, because she has a condition that she can't get treated for, even if she has the money to pay for it, unless she has insurance. And the insurance that she has is through her playing tennis. Through the Association of Tennis Players, they have insurance that they have, which through that, then she's able to receive treatment for the condition that she's been having now for the past 10 years. This is a multimillionaire woman who has all the money in the world, but she's not able to get treatment for a condition that she can pay for out of pocket, because the hospitals have agreements with these insurance companies to say, no, you are not going to treat patients even though they are able to pay for. This is happening, folks. There are other examples of normal, like day-to-day Americans. Here in this particular case, it's I just recently heard about an example of a gentleman an older gentleman who is towards his end of life care right now. He has insurance and he's admitted to a hospital, and he has some chest problems, and so one of the issues that he needed was some pain relief medication in order for him to be able to take the medication that he needs to take. But he can't take the medication without, because the pain is too much. So his daughter wanted to pay for it directly from her pocket in order for her father to be able to receive the treatment. And the hospital said, absolutely not. Absolutely not. Why? Why can't this patient pay for a treatment that they can pay for? Why are hospitals and insurance companies colluding together to say that, no, you know what? A patient can't pay for something even though we are not willing to cover it, but you can't treat them. What kind of madness is this? I mean, this is for me as this is similar to saying, let me make an example about cars, for instance. This is like saying that if you had a car which had insurance, and you took it to the dealer or to your mechanic or whoever, the OEM, to be fixed, and then you fix it to a point where your insurance is willing to cover it, and then there are many other issues that the insurance is not willing to cover, but you are able to pay for it yourself, and then your OEM says, you know what, we can't take your money because your insurance, if we take your money, we can't process our claims through your insurance anymore because your insurance says that we cannot take cash from customers. This is basically what is happening in America. Yes, it is because of lawsuits, but these lawsuits are asinine. the law needs to a law needs to be passed. We need to expressly forbid this practice from happening. A patient needs to be able to get whatever treatment or whatever care they want and whatever the care they can pay for. End of story, end of discussion. Patients, healthcare needs to be patient-centered. Patients can't be held hostage by insurance companies, and hospitals also can't be held hostage by insurance companies. So, and this is just one solution to the problems facing American healthcare system that can be easily fixed right now without spending billions of American tax dollars on healthcare. Because we've already seen through a proper study that was done that the prices that these hospitals are charging patients, uninsured patients who are paying cash, who are paying out of pocket, the prices that they are charging them is much lower than the prices they are charging insured patients, which tells me that the insurance thing is a con. That's basically what it is. They come together with these hospitals, they agree on prices that make no sense, and they are basically fleecing the American people. So this incestual relationship between hospitals and insurance companies need to be looked at properly. It needs to be looked at properly. And it should be against the law for any hospital anywhere in the United States to refuse treatment from any patient who is willing and able to pay for it. I know that the law says no one can be refused treatment. No one can be refused treatment under emergency situations. Okay, fine. Here, this is not about emergency situations. It's about normal conditions that people have, and they go visit a doctor, and then they are told, "No, we can't treat you. We can't treat you because of what? Because an insurance company says you can't treat me." Guys, come on. Because if every patient who visits a hospital can be treated if they can pay for it, what actually you'll start seeing is the prices of healthcare starting going down. Because part of the problem with the prices of healthcare in the United States of America is that this collusion between hospitals and insurance company is artificially pushing prices up. Every single person who can pay for any procedure, any treatment plan, if they enter your hospitals, they need to be given that treatment. As long as they are mentally capable to give informed consent about a particular treatment plan. If a person is able to pay for that treatment plan, they need to be able to receive the treatment plan, whether they are insured or not insured. This thing has got to the point, for instance, in Europe, where for conditions that are very expensive to treat, European nations don't want rich people to be able to get care if poor people can't get the care of that particular condition. That's the kind of collusive behavior that we're seeing with insurance companies. Because actually what is happening now with insurance companies is that they are actually behaving like the mafia. That's basically what they're behaving like. Where the people can't buy and sell services in the open market without being strong-armed by insurance companies. This can't be so. It can't be so. So this is just one particular issue that I wanted to talk about today, to say that I don't see anyone on the Republican side or on the Democratic side who should oppose this. To say that every person should be given the care that they want without any authorization from the insurance and without any repercussions from the insurance. If the person wants care and they are able to pay for it, the hospital has no legal liability to the insurance company for giving that care to that person. End of story, end of discussion. Because in that particular case, many Americans would just live their lives without insurance. Because most people think to themselves, you know what, I can save my own money. Many people have never even been sick in their lives. And they are paying for insurance because they know that one day that they are sick, they're gonna be subjected to this horrible system which is held hostage by insurance companies. But if you let people buy and sell treatment according to willing buyer, willing seller, as we've seen that cash patients are paying much, much lesser prices than insured patients, already that alone should be the end of discussion. It should be the end of discussion. That because the prices, these pricing codes that they have aren't unrelated to anything that is real. They're not related to reality. They are basically taking advantage of American people. And here I'm talking about both the hospitals and the insurance companies. So while we start trying to figure out the issue, okay, how do we raise the living standards of the American people? How do we make sure that everyone is able to pay for the care that they need, or even the care that they want? This is why this universal care thing doesn't work, because it takes systems that are grossly inefficient and codify them and put the taxpayer on hook to pay for it. The amount of inefficiencies and redundancies that come from lack of competition that are in the American taxpayer in the American healthcare system, they are so gross that codifying this thing into making the American taxpayer be responsible would be irresponsible. It would be irresponsible. I think that people should be able to buy whatever healthcare insurance they want, and people should be able also to choose not to be insured. And those who choose not to be insured, they need to be able to pay for their treatment out of pocket without any discrimination from hospitals. Nope. And people who are insured as well should be able to get any treatment that they want, even if the treatment is outside of their insurance plan, as long as they are able to pay for it. These contractual obligations between hospitals and insurance companies are blatantly harmful to the patient, and they should be made unlawful. They should be made unlawful. Also, patients should be able to pay for a treatment that is covered by the insurance company out of pocket if they choose so. That should be their choice. An insured patient should be able to go to a hospital, and when they're asking for insurance and they can say, no, I'm paying out of pocket, there shouldn't be any problem. There should be. This is what I'm saying. An insured patient should be able to choose whatever method they want to pay for their treatment. They should be able to pay for their treatment using insurance, or they should be able to pay for their treatment using cash. The choice should be theirs. It is similar to, in terms of, for instance, when you buy a car and a car is in an accident, and then you take it to be fixed, especially if you take it to an OEM to be fixed. there are no consequences at all for you to get it fixed by OEM and paying for it out of pocket. There is no requirement that the OEM will say to you, no, you know what, we can't replace this or that because of our arrangement with the insurance company. So basically, what I'm saying is that the healthcare system in the United States is a three-legged stool. It's made out of hospitals on one side, made out of insurance companies on the other, and then made out of the pharmaceutical companies. Three legs. Three legs. And this behemoth of a system is not serving patients. It's actually serving themselves. They are serving themselves. All the policies that I'm looking at, all these agreements that exist between hospitals and insurance companies, agreements between hospitals and pharmaceutical companies, none of these agreements are there to serve the patient. It seems to me that every single one of these agreements are actually there to serve the system. And I'm saying that the United States Congress needs to look into this and make unlawful many of these procedures and um, these practices that are happening here. I don't know of any other country in the world that would allow this. I don't know of any other country in the world that would allow people who are able to pay for treatment being refused the ability to pay for it because the insurance company says no. What? What? Folks, are you out of your mind? Anyways, cheers, folks.